My name is Alexa Kalev, and my presentation will be talking about menu labeling and nutritional information on menus. In this presentation, I will be talking about the following topics: menu labeling law by the FDA, why this law was put in place, why we need proper nutrition info on menus, the benefits to menu labeling, the disadvantages of no menu labeling, and the effects of this law. What is menu labeling? Menu labeling is having nutritional information about the food on the menu so that people can be aware of what they're eating when they're at a restaurant, rather than knowing exactly what you're putting into your body when you cook for yourself. Most menu labels list calories. They must have calories listed on all menus, online and in person, and there must be calories listed for everything on the menu, including drinks, sauces, and desserts. Restaurants also must have additional nutritional information upon request, not just calories. Research. In 2009, the Healthy Eating Research did some research on menu labeling. First, they found that restaurants did not provide nutritional information despite consumer interest. Consumers underestimate fat and calories in restaurant food because they don't know any better. What do customers want? The Healthy Eating Research found that most customers want menu labeling. Also, customers rarely seek out nutritional information if it isn't listed at the time of purchase. So seeing the labels will increase their likelihood of ordering something healthy. Studies. When simulation studies were done, it was found that menu labeling reduces calories consumed. But when real-world studies were done, the results varied. Law by the FDA. In 2006, New York City was the first to label menus. New York City was the first to take menu labeling seriously, and they labeled all menus in chain restaurants. This law not only required menu labeling, but calorie labels on 99% of vending machines across the nation. In 2008, the law was implemented. Next was California that passed a state law. By now, over 20 states have labeling policies. In 2010, the CSPI tried to pass the law of national menu labeling. The FDA were delayed years before finalization. In May 7, 2018, the law was implemented. Some of the rules that are included in this law are disclosing calories for standard menu items listed on menus and menu boards, disclosing calories for food on display and self-service foods that are standard menu items, include on menus and menu boards a statement concerning suggested caloric intake and a statement that additional nutritional information is available upon request, and have the required additional written information available upon consumer request on the premises of the covered establishment. Who must comply with this law? The establishments that are required to comply to these rules are restaurants that are selling food that are part of a chain with 20 or more locations, doing business under the same name and offering for sale substantially the same menu items. Some of these places include restaurants, grocery and convenience stores, food takeout and delivery services, entertainment venues, cafeterias, coffee shops, superstores, and some managed food service operations. Covered establishments must provide a statement that is signed by an individual who is employed at the covered establishment, its corporate headquarters, or parent entity that the nutrient information is accurate. Also, this must state that the establishment has taken the correct steps to ensure the preparation method is the same which the values were determined. Why do we need this law? More than 1/3 of adults in this country are considered obese, and restaurants have a lot to do with this. Now, if people want to eat at a fast food chain, at least they know how many calories they're consuming. It's important to make healthy and informed choices when eating out, and recently, eating at a restaurant is making up 1/3 of Americans' daily calories. Obesity can be deadly, and it can lead to other issues like heart disease, diabetes, or even cancer. There are many benefits to labels. Retailers are persuaded to make their food healthier. Because of the law, restaurants are now incentivized to be making healthier foods because seeing those unhealthy nutrients and high calories will turn away lots of business. Next, lowering medical costs. Medical costs will go down greatly due to the population being generally healthier. Obesity is the leading cause of many illnesses, and with the lower rates, the country will be saving tons of money. A study showed that if Americans reduced their sodium intake by 1,200 milligrams, the country could save around $20 billion. Next, Americans will make healthier choices. Being aware of the nutritional information definitely has an impact on what you're going to order at a restaurant. Lots of times, you think a salad sounds healthy on the menu, but you look over and it has over 1,000 calories. Without that label, you would just be deceived to think that you were having a low-calorie lunch or dinner, when in reality, you would be eating most of your calories for that one day. Next is obesity rates going down. A study found that menu labeling impacted urban areas and decreased body mass index by 0.9% in women, 1.4% in men, and 2% reduced body mass index in obese men. No menu labeling can have its disadvantages. Blind eating. Blind eating is basically eating food and consuming drinks that you have no idea what's in them. You could be putting so much fat or sodium into your body from one meal and you wouldn't even know it. Because Americans eat at restaurants so much, it's likely that without labeling, most of your meals are consisting of unhealthy nutrients. Restaurants are also profiting off of your lack of knowledge. Restaurants did not want to put labels on their menus because they knew it would take away business. Restaurants were profiting off of kids going to places like McDonald's for lunch and not really realizing how bad the food is for you. With information coming out about the nutrients in McDonald's, the business has gone down. Families don't want to take their kids to McDonald's now, knowing how bad the food is. Restaurants were benefiting from the public's lack of knowledge about the food to gain business. Menu labeling can be a controversial topic. Some of the reasons why menu labeling is controversial is because it's expensive for restaurants. Also, menu labeling exposes the truth about the food. On the other side of the controversy, the public wants answers. Business owners on one side of the controversy say that menu labeling can be costly because they have to remake their menu boards, and the testing to analyze nutritional value on food is time-consuming and pricey. Another reason menu labels is controversial is because restaurants are being forced to tell their customers what makes their food tasty: the salt and the fat. On the other side of the controversy, the public wants the nutritional information to be readily available to them. Health is so much more prominent now than ever. People are becoming so aware of nutrition and foods and are more conscious of their health. Also, the government wants to lower the risk for disease, and labels on menus is a good start. How do we know the law is helping? Some studies show that not all customers even notice the labels. This study varied from 28% of people to 68%. It was also found that the same number of calories were ordered with and without the labels. The calories that are listed are being read by consumers, but ignored for the higher calorie option anyway. This law does not seem to have any impact on fast food chains. It was found that the customer makes a difference when it comes to menu labeling. For example, women who are between 18 and 24 years old and live in a high-income neighborhood are likely to use calorie labels to their advantage and make the lower calorie choice. Essentially, the law having an impact comes down to the customer. This can be based on many things: low income, high income, or minority neighborhoods. In conclusion, we've learned that menu labeling is important. This law was controversial. We've learned about the results of the law. Also, that the FDA has strict regulations when it comes to menu labeling. First, menu labeling is important and should have been implemented a long time ago. The law being implemented a while ago could have possibly reduced the obesity in the country before it became an epidemic. It could have reduced many other health problems. Menu labels are allowing for consumers to make healthy choices when they're eating out and not feeling like they are forced into eating bad because they couldn't cook that night. Eating outside of the home is making up a large part of the average person's calories currently. This being said, if you are getting a lot of your nutrients from restaurants and outside places, you should be making sure that there are good nutrients that are going to be better for your overall health. Next, the law was not an easy one to pass, and it still is controversial. Restaurants are not happy about the law because of the cost, the time, and the business at stake. Restaurants aren't really able to just serve whatever food they want now because people who are reading the labels will be turned away. The cost of redoing a menu and analyzing food for nutrient value is not easy. On the other side, us as customers should have the right to know what we are eating. We don't know for sure if the menu labeling law has changed much. We do know that in urban areas, the obesity rates have gone down, and we know that in wealthier areas, the law seems to have an impact. In majority of areas across the country, the results vary. Also, we learned that the FDA tried for many years to put this law in place. Now, over 20 states have laws. There are specific guidelines for what establishments must have menu labels, and there are certain foods that must be labeled.